We thank you for staying with us here on News Talk. Bruce DePoit with you on this Wednesday. While U.S. health officials scramble to improve protocols for dealing with Ebola in this country, where we've had a handful of cases, agencies and companies that have a presence in West Africa are facing an even more daunting task. NGOs, government and private sector personnel in the countries hardest hit by the virus face significant exposure risk on a daily basis. The job of protecting them falls to men like our next guest. Amaury Cooper is Deputy Director of Security for International Relief and Development Incorporated. Thanks very much for coming in. It's good to have you here.
Happy to be here.
What a significant challenge we face at this moment in West Africa primarily. We'll talk about the situation here in the U.S. too, because I know people are concerned. But we're talking about thousands of cases in several West African nations now, with every expectation that this will grow substantially over time.
Absolutely. And I think one of the biggest concerns that we look at is that, right now it's been isolated to these countries, but the porous border areas that exist in the region are actually allowing, or could allow, the disease to spread into other areas. So I think that's what a lot of the biggest concerns that people are facing now.
What sort of strategies are folks like you putting together now?
Well, for instance, International Relief and Development is putting in place, we're making sure that we have program continuity, business continuity plans in place so that, should the areas become affected where we operate, we can continue programming, because while this disease obviously is horrible and it affects thousands, millions of people, there are a lot of other issues that are being faced in the same areas, development issues, other diseases, etc.
And that means, I'm sure, developing in conjunction with health professionals safeguards and plans, and then communicating those in a detailed and probably repetitive manner to the people who are in the field, who are doing the work.
And so there's two sides. There's the health and safety aspect of making sure that our staff are following whatever procedures, and we've sent out information, for instance, to our staff in the countries that are on the periphery of that, to sort of what the signs are to look out for. But additionally, it's putting in place, making sure that they have all the emergency contact information, that again, business continuity plans are in place, evacuation plans are in place for those foreign staff who are there, if need be, but then also looking at the broader context of security as a whole. They do need to continue to operate, continue to do the work that they do, and so making sure that they have the tools, skills, and training that they can to operate safely in all the different projects that they operate in.
Right. Talk about IRD. What do you do? What is your mission?
International Relief and Development has been around for a little over 15 years now. It does relief and development operations worldwide, everywhere from South Asia to West Africa, East Africa, the Middle East. A lot of government and other donor monies fund these projects, everything from infrastructure to health education, well, I say construction already, yeah, but across the spectrum of development.
What has happened in Dallas over the course of the last few days reinforces the need not only for protocols, but for training and for a really meticulous execution, if you will, of whatever the protocol is. I'm talking about getting right down to the level of how not only having the suit, wearing the suit, but how you take the suit off. Yep. And I don't know that we have a definitive sense yet of everything that may have happened to the medical personnel in the Dallas area. Signs do point, I think it's fair to say, to that concern, that issue now, but bottom line, you can't be too careful.
No, you can't, and I think it goes to anything, any type of illness or disease or any safety concerns. You have to train, and training is one of those things that has to be done repetitively over and over again so that it becomes sort of muscle memory. It's not just a one-off thing, you take a course, it has to be practiced, and there has to be oversight. So whether it's donning a suit to make sure that you have protective gear, or if it's just following basic protocols and procedures for communication between staff, you have to practice them and make sure that they're enforced.
Relief personnel who are in the countries most affected by Ebola bring a lot of care and a lot of passion to their work. I know they are reluctant to leave in an hour and at a time of crisis, because the work they do, whether we're talking about doctors, whether we're talking about people who are doing other things in the community area, community development and aid area, they care greatly about what they do, and it goes against the grain of their belief system. Yeah, to leave, even though at some point, I'm sure that enters at least the discussion.
It does, and I think it goes to a larger issue about targeting of aid workers. Has become much more prevalent now. We've seen whether in Africa in September, where there was aid workers were killed who were trying to protect against Ebola, but then you see it across the world. The rise in attacks against aid workers has increased dramatically. Since January, there's been 207 incidents of attacks against aid workers, and predominantly towards local staff. It makes the news when it's international staff, but the fact is that the predominant 90% of the incidents have been against local staff who themselves are going out there, and they can't evacuate. Not only do they believe in that, but then they don't have the ability to get out. And
that sort of thing is so outrageous and so unsettling. We're not talking about a conflict between militants. No. We're talking about going after folks who are trying to do good in the world, trying to help one another, and are not in any rational sense connected to whatever the
politics,
the conflict on the battlefield is, so to speak.
No, and you're absolutely right. And in that manner, great case in point is polio workers who've been in Pakistan who've been attacked for the last few years now. These people are, like you said, putting themselves on the line in areas that are controlled by the Taliban, controlled by other insurgent groups, and they're being attacked because of political issues, even though they themselves are really just going out there to try and to make the world and people safer and healthier.
So how has how have these incidents affected the training and the decisions about the people in the field?
Well, I think overall NGOs, security within the NGO world has grown dramatically. Traditionally, it's not that they didn't have security, but they never looked at it as being a primary sort of concern. They sort of looked at security as being much more along the lines of acceptance by the communities because of the work that they were doing. And for a long time, they could actually count on that. But more and more aid workers are being targeted because they are soft targets in increasingly complex and conflict areas. So organizations themselves have started, really developing and having actual internal security departments to make sure that protocols, procedures are in place to ensure that staff follow those procedures and have expertise to make sure. Let them focus on doing the aid work, doing their expertise of whether it's inoculations or building bridges or digging wells, and put people who can focus solely on security in positions so that they can do the things that need to be done: training, promoting, and enforcement of security protocols.
The things that are in their wheelhouse.
Exactly.
This has to be a nervous time for family, for people with sons or daughters, moms and dads, siblings, in areas where we know a difficult to treat disease is running rampant. Epidemic, I think, not too strong a word.
Yeah. I think it's hard for. Absolutely, and I think a lot of
coworkers too.
And coworkers, yeah, absolutely. I think it's hard for them to deal with oftentimes even when there isn't an issue, because they are going into these places that are highly underdeveloped and certainly not to what they're accustomed to. It becomes more important to make sure that those family members, and we like to make sure that our job is to make sure that family members can call out to us as well. Mm-hmm. We can give them the information that they need. We have a 24-hour hotline, for instance, that's available to staff, but also to family if they need to have information about what's happening in the area. And they need to have just as much information about the situation on the ground. Keeping them in the dark certainly is not going to calm them down any more than.
We only have a minute left.
Sure.
As it's clear that the CDC is taking steps to update as needed their protocols. Is this something you're watching in order to be able to communicate abroad?
Absolutely. I mean, we follow the news, relentlessly, and certainly when it comes to that, we promote and push out the news as soon as we get it to the field, either through any number of means, whether it's emails, phone calls. We have a weekly meeting among our groups just on Ebola planning, for instance, just to make sure that in the areas where we do operate, our staff are aware of what the symptoms are, aware of what what needs to be done, and again, are focused on how do we continue to operate if Ebola arrives in those areas.
Amaury Cooper is Deputy Director of Security for the International Relief and Development Incorporated Organization. Thank you very much for your time today. Big topic. Thanks very much for coming in and sharing your perspective.
Appreciate it very much.
We'll step aside here. We're back, though, with more News Talk here on News Channel 8 right after this.